Hello and welcome to another episode of the CIRS Group podcast. I'm Jacie,
And I'm Barbara.
and today we're talking about haplotypes. So, very often when we're talking about CIRS, we talk about that genetic predisposition, and the haplotypes are that genetic predisposition. So, that's what we'll be discussing today. I don't think any of this is like actionable medical information, but our usual disclaimer, we're not medical providers, so make sure you discuss anything to do with your treatment, your symptoms with your provider before making any medical decisions. Without further ado, we'll jump right in.
All right.
So haplotypes, these are also called HLA genes, and this is something that you will identify as part of being diagnosed with CIRS. So, if you think you have CIRS, you'll look at the symptom clusters. If you have 8 of the 13 symptom clusters, you do the VCS test. Whether you pass the VCS test or not, it's still a good idea if you have 8 of the 13 symptom clusters to get the blood work. And the blood work comes in two parts. The first part is testing the genetic predispositions. It's going to show you those haplotypes. And the second part of the blood work is going to show you the innate immune response you're experiencing as an effect of CIRS.
Yes, and it is important to note that the genetic part, the haplotype part of the blood test, is expensive, usually. And I'm talking like a few $100s, not like thousands, but still, it's expensive. But it's your genetics. G- Generally, they don't change. So you just have to test it one time. And that is actually part of the official way of diagnosing if you have a history of exposure. You have the symptom clusters that JC just described, and then you have one of the genes that have been identified as associated with CIRS. That's all you need, folks, and then you get to go do the Shoemaker protocol. It's a good time. Then you're in the cool CIRS club.
Like
What can I say?
Candyland, you
Yeah,
get to move forward to, I can't remember any of the Candyland names.
I certainly can't either.
Okay, let us know in the comments down below. Favorite Candyland spot.
Yep.
But the haplotypes. So these, again, are the genes that are related to the immune response. So with CIRS, it happens when you have a genetic predisposition being really bad at eliminating a biotoxin. And what that effectively means is your body doesn't know how to remove that biotoxin. Your genes don't have the instructions for creating the antibodies that would allow you to remove that biotoxin. You get stuck in the innate immune response, and that's what causes the chronic inflammation of chronic inflammatory response syndrome. There's a really great resource about the haplotypes, and there's an HLA FAQ and a calculator. It's at myhousemakesmesick.com. It is my favorite place to go for anything haplotype related. So we'll definitely leave that in the show notes.
The fun thing about the haplotypes is that they can specifically identify what you are susceptible to in the realm of biotoxins. They can get a little bit more specific than just, oh, I have CIRS. That said, when you have CIRS, you have CIRS, and it still sucks. So it's good information. It's nice to know. And JC, I'm sure we'll go into it even more. But some of the different haplotypes identify you as being specifically susceptible to mold, Lyme, or tick-borne illness. There's also the multi-susceptibility one, which sometimes people say is the dreaded gene, which, JC and I happen to have because we were the cool kids and we like to do things the hard way, apparently. But then there's also ones that specifically identify vaccine, like Gardasil. There's a haplotype for that. There's also one related to Marcons or antibiotic resistant staph, which is something that I think 80% of CIRS patients have in their nasal cavity when they get tested. And then there's also one that's just specifically low MSH. That one does tend to, if you have the low MSH one, it's possibly harder for you to raise your MSH as you go through treatment. So again, these do maybe inform you a little bit about how your treatment may go and what things to look out for, what things for your doctor to look out for in treatment. But really, CIRS is CIRS is CIRS. And if you have any of the haplotypes, then you are susceptible to having CIRS.
Yeah, and just to double down on that, because I hear a lot of rhetoric about the dreaded genes, which are the multi-susceptible haplotypes. And to me, that's a little silly because if if you're at the point where you're identifying your genes to say you have CIRS, like you already have CIRS. It doesn't matter if you're multi-susceptible. It's like you're already there. It doesn't matter what you interact with. You already have CIRS. Where I think it's more helpful to understand, the different genes you might have is if you yourself have CIRS and you have kids, or you're planning to have kids. Because this is genetic, it's very likely you're going to pass genes down to your children, and allowing them to understand what they might need to be careful of as they move forward in life is going to be a tool that you didn't get to have because you had to go through the process of having CIRS to find out about these genes. So I really see it as a powerful tool, especially for people who have kids, or even if you have family members, like let them know, like, hey, I found out we have this genetic thing. I don't know if you have it, but it's definitely worth getting tested for it just to see if you might need to be careful of water damaged buildings, etc.
Yeah. And for just more in-depth information about kids and their experience with CIRS and how to talk to them about this, we just did an episode with pediatrician Dr. McMahon, also one of the first certified in the Shoemaker protocol. And he goes into all of this in greater detail in that episode. So definitely check that out if you missed that.
And just a final note on the genetics piece, because it is passed from parents to children, if you have two or three of the haplotypes, it means that both of your parents had to have CIRS genes in order for you to have that many, which again is just, it's good to know, right? Like if your parents have been dealing with chronic health issues their entire lives, like my mom certainly has, and my dad has been diagnosed with things like IBS, like those diagnoses that diagnoses that aren't really identifying the root cause, they're just explaining the symptoms. Like if you have family members who have those kind of diagnoses where it's like fibromyalgia, it's like not really identifying the root cause, but just explaining the symptoms, but in Latin. It could be helpful for them to know about this genetic predisposition you all have towards CIRS.
I also want to quickly validate a slightly unrelated, but I think an important tangent is that if you are having any trouble convincing your family that they have CIRS, knowing this information about the genetics, that is unfortunately pretty common. And I just want to validate that it's not you, it's just
Them, they gave you the genes.
it is them,
They're the
right?
problem.
They are. No, but something that has helped me kind of grapple with that is if you do your best as the example and go through the treatment yourself, get yourself well, heal yourself, and then maybe when you have the strength after you get through the healing process to maybe be more assertive or aggressive, you can point out. I know there are some people in the CIRS community who did basically have to do that. They had to heal and then go, "Hey, husband, look, I'm better. Do you remember how I was 2, 3 years ago and how awful that was? And now look, I'm walking, or some huge difference." Sometimes that is what it takes to get someone else on board. And that's a whole other topic. Like I said, I don't want to go down a rabbit hole, but I just want to validate that experience is common for people with CIRS. We have found the answer. Great. Doesn't mean that our family is necessarily going to be on board until they see results. And even then, maybe sometimes they won't. We just have to do the best we can with sharing the information and hope that they take it seriously if they do. And sometimes people need to hit some version of their own rock bottom before they feel motivated to try. So just want to add that reassurance in case anyone needs it.
And if you are looking for more resources and support in your CIRS journey, you can join us over at the cirsgroup.com.
We'll see you there.